So as in our previous video, we have discussed who are the ideal people or candidates who has to go for screening. So we will make subsequent series of videos in order to impart the knowledge which is required for you to tackle and identify diabetes from day-to-day life. So basically what people generally know is there are diabetes is of only two types, type 1 and type 2 diabetes. So type 1 diabetes is the diabetes which is autoimmune in origin. That means the people are born with propensity to develop the diabetes because their own immunity destroys the insulin producing beta cells in the pancreas. So this type of diabetes, it appears at early age of life, maybe between 12 to 15 years, because when these people they develop adolescent age or the growing age, when they undergo puberty, during the time of puberty, large number of hormones will be produced in the body like cortisol, growth hormone, estrogen, progesterone, testosterone. These hormones, they create a state of insulin resistance in the body, and because of the insulin resistance, type 1 diabetes, they tend to present at between 12 to 14 years, and usually these people with type 1 diabetes, they present with vomitings, pain abdomen, severe dehydration and hypotension, which is classically a feature of diabetic ketoacidosis. So most of these people, they present either with diabetic ketoacidosis, or some of the people they present with classic signs of diabetes like polyuria, polydipsia and weight loss, and subsequently become diagnosed as type 1 diabetes. So because of increased screening programs, we are now able to identify large number of children with type 1 diabetes also. The other spectrum of the diabetes is type 2 diabetes. So type 2 diabetes is the diabetes which is classically seen because of insulin resistance, whereas type 1 diabetes is because of absolute insulin deficiency, where beta cells of the pancreas are not able to produce sufficient insulin. But in type 2 diabetes, there is insulin resistance. So type 2 diabetes comes in a spectrum of disease called as metabolic syndrome or syndrome X, popularly known as, which we will be discussing subsequently. So in type 2 diabetes, the classic body type of the patients with type 2 diabetes will be obesity. They will have truncal obesity, the pear-shaped structure of their abdomen. Men will have apple-shaped structure of the abdomen, or women will have pear-shaped structure of their abdomen and hip. So the basic pathology in type 2 diabetes is development of insulin resistance, wherein because of the presence of obesity, that is truncal obesity, the body will produce large number of counter-regulatory hormones from the fat tissues present in your abdomen like adipokines, adiponectin. Because of these hormones, there will be development of insulin resistance, and because of which the initial insulin levels of patient with type 2 diabetes will be far higher than a normal population. That is because your insulins will work 2 times, your beta cells will work 2 times or 3 times higher in order to compensate for this insulin resistance. But we remember the fact that any organ which is overworked or anything which is overworked will always undergo some sort of damage. So because of this hyperglycemia, high sugar level, because of high fat level, and because of the overworking of these beta cells of the pancreas, in due course of time in patient with type 2 diabetes mellitus, they suffer from loss of the beta cells, and after 8 to 10 years of type 2 diabetes, when they have suffered from significant loss of the beta cells, they also tend to become insulin dependent because of a lack of sufficient response to oral hypoglycemic drugs. So now I reiterate once again, there are broadly type 1 and type 2 diabetes. Type 1 diabetes seen in younger population before 25 years of age group, they are insulin dependent, and type 2 diabetes is seen in older population, or you can take as now in current scenario above 35 to 40 years, where they will have truncal obesities and subsequent. These are the broad classification of diabetes. In subsequent videos, we will learn more about what are the mechanisms that take place in type 1 diabetes and what are the mechanisms that takes place in type 2 diabetes through which the hyperglycemia are promoted. And in subsequent videos, we will learn what are the effects of hyperglycemia on different organs and why it is essential to identify the hyperglycemia early and treat hyperglycemia with strict control in your young age so that you don't face problems in the older age.